So thank you very much for the introduction. And now I welcome you to my presentation, long-term evaluation of the initial response to therapy categorization in 60 dogs with chronic inflammatory enteropathy, and how are things 1 year later. First, I have no conflict of interest related to this program. The definition of chronic inflammatory enteropathy is that there has to be a presence of chronic gastrointestinal clinical signs, and histologic evidence of intestinal mucosal inflammation is needed. Other causes for gastrointestinal signs have to be excluded. CIE is retrospectively categorized according to the response to therapy into 4 groups: food, antibiotic, immunosuppressant, or non-responsive enteropathy. Until now, only few studies have evaluated the long-term outcome of these dogs, and no study ever assessed the frequency of a category change over the long term. So our aim was to investigate the validity of the initial CIE categorization at least 1 year after the diagnosis. Our hypothesis was that the CIE categorization will change considerably after at least 1 year. Our inclusion criteria were that the dogs had to be presented for chronic gastrointestinal signs between 2018 and 2021 at our hospital, and the dogs had to fulfill the criteria for CIE, and the follow-up of at least 1 year was needed. So data were collected by interview, medical record search, and if needed, the referring vet was also contacted. And in order to get information about the course of disease of these dogs, data were collected from 3 different time points: time of diagnosis, time of initial response to therapy, and time of the interview. The categorization was made according to the response to therapy into these 4 groups. And here it's important to notice that immunosuppressants were used as a second-line therapy instead of antibiotics. Means that the dog was categorized as IRE even without a previous antibiotic therapy trial. As it has been recommended to adapt the diagnostic approach in dogs suspected of having CIE, but this will be part of the discussion later. So response was defined as remission, partial remission, or no remission, and the definition of category change was a switch between these 4 groups. Now to the results. The black bars represent the categorization at the time of the initial response, and the white bars represent the categorization at the time of the interview. 40% of the dogs showed a change in category, and the most common change was from IRE to FRE, and this included also dogs older than 10 years. And a quite unexpected finding was that no dog could be assigned to the ARE group at both time points. Now we are comparing our results with other long-term studies. I would like to outline that our proportion of the IRE group was comparatively high. We believe that there are 2 reasons for that. One is the change in therapy sequence, and the other is that many owners expect more than a further diet trial after an expensive diagnostic workup. And since antibiotics were not considered as a feasible therapy option in these dogs, most of these dogs received initially immunosuppressants. In 90% of these dogs, the diet was also changed. And we assume that after gradually decreasing the dosage of the immunosuppressants, the owner began to realize that diet alone can also be an efficient therapy option in their dogs. And at the time of the interview, nearly 3/4 of the dogs were categorized as FRE, and this is consistent with other studies. In our study, the most often used immunosuppressant was budesonide. In other studies, the most often used immunosuppressant was prednisolone. And all but one dog received a non-immunosuppressive corticosteroid dosage at the time of the initial response, and all dogs without the medication change had a further dose reduction of at least 50%. The long-term outcome of our study was comparatively good. At the time of the interview, 77% of the dogs were in remission. But here I have to mention our inclusion criteria again. A follow-up of at least 1 year was necessary. Means that dogs with a very severe course of disease have been automatically excluded. Now we are going to discuss the following topics: category change, use of antibiotics, and immunosuppressants. So the question is whether this is an effective change in response to therapy, or whether this study provides further evidence that dogs can respond to diet even after a second or third diet trial. And we don't know if these dogs would have responded to diet alone even without an induction therapy with immunosuppressants, or if a certain proportion of these dogs need this induction therapy in order to then fully respond to diet alone. And as already mentioned, many owners prefer medications to diet, especially in the beginning. As already mentioned during the morning, there is a debate about the usefulness of A or E, since dogs with A or E have a comparatively poor outcome, and they show often relapse of the clinical signs after discontinuation of antibiotics. In 2020, a paper was published in which the authors proposed a new diagnostic approach in dogs suspected of having chronic enteropathy. The author said that antibiotics should only be given if biopsies prove an infectious cause, and if biopsies are not possible, antibiotics should only be used if all other empirical therapy options have failed. So similar to this paper, in our study, we used immunosuppressants instead of antibiotics as a second-line therapy, and we assume that this change in therapy sequence is the reason for the 0 ARE dogs. Nevertheless, the long-term outcome of our study was very good, but for sure, further studies are needed to validate these findings. In our study, the most often used immunosuppressant was budesonide. Positive responses to budesonide have already been reported regarding the initial response to therapy. Our study now indicates that budesonide can also control clinical signs in the long term. And there was a considerable dose reduction possible over time in our IRE dogs. But currently there are very little data regarding the long-term dosages of these dogs. But as most of these dogs responded to a non-immunosuppressive corticosteroid dosage, the term immunomodulator responsive enteropathy may be more appropriate in most of these IRE dogs. So the clinically relevant take-home messages are: there is a considerable switch between CIE categories over time, and FRE dogs often require more than just one diet trial. In our study, we used immunosuppressants instead of antibiotics as a second-line therapy, as there are several reasons for the so-called prudent use of antibiotics. Despite, or perhaps because of this change of the second-line therapy, the long-term outcome of this study was comparatively good. And almost all IRE dogs responded to a non-immunosuppressive corticosteroid dosage. Thank you very much for your attention.